Now let's move on to about the blood supply in the pelvic region, guys. Let's see about the internal iliac artery and what are the various branches given by that. And there is one beautiful concept here. Let me tell you about that one here. So let's go one step back here. Like basically, where is that internal iliac artery coming from, sir? So we have learned about the abdominal aorta in the abdomen topic. So in the abdomen topic, we have learned about the abdominal aorta. You just imagine this one to be the abdominal aorta. That will be dividing into the common iliac arteries. We know very well, abdominal aorta will divide into the common iliac arteries at the level of lower border of L4. Abdominal aorta will be extending from T12 to L4. So at the lower border of L4, it will be dividing into the common iliac arteries. Now this common iliac artery will give rise to the internal iliac artery, and it itself will actually continue as your external iliac artery. So I'm just writing in short here. This one is common iliac artery and this one is external iliac artery. External iliac artery will further continue down as the femoral artery in the lower limb. So you don't have to worry about that right now. We'll study about that in the lower limb topic. But for now, you have to remember that this internal iliac artery is given at which level? Remember, it is given at the level of L5. So at L4, abdominal aorta will divide into common iliac arteries, and that common iliac artery is further giving rise to internal iliac artery at the level of L5. So our concentration right now is all about the internal iliac artery here. Now this internal iliac artery will be further dividing into two divisions. One is the posterior division, another one is the anterior division. So out of those two, let me just draw it like this here, sir. The posterior division, and you just imagine this one here to be the anterior division. Now out of those two, like we need to learn what are the branches given from the posterior division and anterior division, obviously. The easy way to do this one is always like every student will be learning in the same manner. I want you also to learn in the same manner, guys. The easy way to learn here is learn the branches given by the posterior division. Posterior division will just give like 3 branches here. And those 3 branches, students love to remember with the mnemonic S, S, I, L, SIL branches. SIL, SIL branches here, sir. And once you remember these 3 branches, remaining all the branches are from anterior division only. That's all. So there are only 3 branches given from the posterior division of internal iliac artery. So internal iliac artery will be dividing into 2 divisions, anterior and posterior division will give rise to only 3 branches. Out of these 3, S stands for superior gluteal artery. Superior gluteal artery. And then I stands for iliolumbar artery. Iliolumbar artery. And then L stands for lateral sacral artery. That's all, guys. So remember SIL, SIL branches. S for superior gluteal artery, I for iliolumbar artery, and then L stands for lateral sacral artery. That's all. These are the 3 branches which are given from posterior division. Anything else? Everything will be coming from the anterior division. So if they give you the question, all of the following are the branches from posterior division except one, I hope you will be easily able to handle. Now welcome to what are the branches given by anterior division and what is that important concept that you have to learn here. So first, let us deal with the branches here. If you are done with the superior gluteal artery over here, definitely the anterior division is the one which will give rise to inferior gluteal artery. Inferior gluteal artery. Okay, that is one easy logic that you can apply here. Posterior division is giving superior gluteal artery, so anterior division has to give the inferior gluteal artery. One easy logic. Now, I don't want my student to just write it like a list and just mug up, guys. That is the reason why let us try to make a concept here in our mind. In the very beginning of the pelvis topic, this pelvis and perineum topic, I have shown you the sagittal section of female pelvis. First, you'll be having urinary bladder. Behind that, you'll be having uterus and vagina, and then there will be a rectum there. So you actually do the same thing. These arteries are going to supply to the pelvic viscera only. So go in the same order of the pelvic viscera. I actually remember in the same manner. I want you also to remember in the same manner. So first of all, the urinary bladder. Urinary bladder also known as the vesicle. So that is the reason why, remember, there will be 2 arteries here. One will be the superior vesical artery and then there will be a inferior vesicular artery. So there will be a superior vesicular artery and then there will be an inferior vesicular artery. But you have to be like really careful with the inferior vesicular artery. Why? Because inferior vesicular artery is present only in the male. Superior vesicular artery is present both in male and female, but remember, inferior vesicular artery is present only in males. Then what about the female? In female, you don't have the inferior vesicular artery. But instead of that, the homologous of that or similar of that one will be the vaginal artery. So in females, the same inferior vesicular artery, instead of inferior vesicular artery in the females, there will be a vaginal artery present over there. That is the one important thing that you have to remember here. So that's about the urinary bladder. Then slowly moving behind, we are done with the vaginal artery. Then what about the uterus? Of course, you'll be having the uterine arteries. So for the uterus, you'll be having uterine artery. Then after that, what about the rectum, guys? For rectum, obviously there will be rectal artery. But you have to be like very careful here. Will it be superior rectal or middle rectal or inferior rectal artery? Remember, the anterior division of internal iliac artery will give rise to middle rectal artery. Middle rectal artery. Then after that, the next one that you have to remember here will be obturator artery. Just add two more here, sir, obturator artery. And then the last and final one will be the internal pudendal artery. Internal pudendal artery. And I think we have already discussed internal pudendal artery. This is the one which will be further giving that inferior rectal artery. So when it comes to rectum, you have to remember about the superior rectal, middle rectal and inferior rectal. Let me just clarify a little bit more here without confusing you. Superior rectal, recall from the abdomen topic. Superior rectal artery is a continuation of inferior mesenteric artery. Inferior mesenteric to the hindgut. Middle rectal artery here, it is a branch of internal iliac artery only. To be more specific, anterior division of internal iliac. Internal iliac artery will give rise to middle rectal. What about the inferior rectal? Inferior rectal is further a branch of internal pudendal artery only. And that internal pudendal artery is of course again a branch of your internal iliac. So that is how you have to actually remember very carefully about the rectal arteries here. Superior rectal, the middle rectal and the inferior rectal. Now once you are comfortable with this entire concept here, now let me tell you one very important thing in relation with the vesicular arteries. There are like so many questions which are being asked about the vesicular artery. So imagine this one here to be the urinary bladder. This will be the apex of the urinary bladder, and then there will be neck and body and all. Hope you all know that the apex of the urinary bladder will actually be attached with a ligament, and that ligament will be going and attaching with the umbilicus part. That is nothing but medial umbilical ligament. Median umbilical ligament. Median umbilical ligament. And along with that, just adjacent to that one, there will be two more ligaments there. And those two more ligaments present over there will be the, of course, medial umbilical ligament. Let us write down the names very clearly here. So towards the median, there will be medial umbilical ligament. And this one here will be the median umbilical ligament. Perfect. Now, what about the arteries which are actually supplying to the urinary bladder? Urinary bladder is supplied by vesicular artery. One is superior, another one is inferior. So there will be a superior vesicular artery, and then there will be a inferior vesicular artery. Just for the sake of representation, I'm drawing here like this. So there will be superior vesicular artery, and then there will be inferior vesicular artery. Perfect. Now what I'm trying to teach you here, these superior and inferior vesicular artery, some important points that you have to remember. Out of these two, remember, the inferior vesicular artery is the one which is present in the males only, not in the female. It is not present in the female. It is present only in the male inferior vesicular artery, and homologous to that one in the female will be the vaginal artery. First point to remember. Second point to remember here is, what is this median umbilical ligament representing actually? Remember, the median umbilical ligament is actually representing the urachus part. I hope you are able to recall from the embryology, urogenital sinus and that urachus wala part and all. Whereas the medial umbilical ligament is a remnant of umbilical artery. I know 99% of the students will be answering that. Medial umbilical ligament is a remnant of umbilical artery. But in the exam, they are more specific whether it is a remnant of proximal part or distal part of the umbilical artery. Remember, the medial umbilical ligament is a remnant of distal part of umbilical artery, guys. So medial umbilical ligament is actually a remnant of distal part of the umbilical artery. Then what about the proximal part? Remember, that is nothing but the superior vesicular artery. So superior vesicular artery is the remnant of proximal part of umbilical artery. So superior vesicular artery is the remnant of proximal part of the umbilical artery, whereas distal part of the umbilical artery remnant is nothing but medial umbilical ligament. Perfect. And last, one more thing that I want you to recollect from the abdomen topic. In the abdomen topic, when we learned about inguinal canal, one of the content of the inguinal canal in male will be spermatic cord, and inside the spermatic cord will be having vasa deferens, and that vasa deferens will be supplied by an artery to vasa deferens or artery to ductus deferens. That also has been tested in your exam. Artery to ductus deferens is a branch of which one? Remember, the artery to ductus deferens is a branch of superior vesicular artery only. So superior vesicular artery will also give a branch, that is artery to ductus deferens. So like so many questions are being tested here about the superior vesicular artery and about the inferior vesicular artery, and you know about the medial umbilical ligament, median umbilical ligament. So many questions are being asked here. So please take care about this part here. So that is the important concept which I wanted you to understand very clearly when it comes to the branches of internal iliac artery. So don't try to just mug up all the branches like a list here. So try to understand what are the important concepts associated with that one and what you have to learn, guys. So that's all about the internal iliac artery and its branches.